Hello everyone, this is topic on fistula and NO, also known as anal fistula, and there's a rule to identify the internal opening of this fistula. That's known as Goodsall's rule. So, all right. So first of all, what a fistula is? Fistula is a tract uh, through which secretions can happen. Suppose after an anorectal abscess or something infection, after the infection, a fistula gets forms. So after that fistula gets formed, so that that secretion from that abscess can be um, drained. So this is how our body works. This is how body tries to um, eliminate that secretions, if there was an abscess or something. So fistula is formed. So let's talk about this fistula in NO. So this fistula gets formed in the anal region. Yeah. So first of all, fistula has two openings. Yeah, it is an internal opening and it is an external opening. Yeah, external opening, most of the time, many times it can be through the skin. It can reach till the skin too. Yeah, so there's an internal opening and there's an external opening always. Yeah, it's all about this because it's a tract. It's a kind of a tube. Yeah, that gets formed. So this is a fistula, and fistula in NO, to be precise, is in the anal region. So that's why it's anal fistula, also known as anal fistula. So here I have drawn a diagram. So not a complex one, so just to make you guys easily and just to explain easily. So here's your rectum. This is your rectum area, and this is your anus. Yeah, anal area, and these are the columns. Yeah, these are the columns between rectum area and the anal area, and this is the transitional zone. Yeah, this area is the transitional zone between the rectum and the anus. Yeah, and Morgagni are these columns, also known as anal columns. Yeah, these are the columns. Yeah, these can be easily identified. um, so this is the anal columns, and here you can see, here I've drawn this is known as anal crypt. Yeah, this is the anal crypt, and these are the glands, yeah, present in the anal region. So the secretions also from the gland also take place, and they can go through the crypts. Yeah, so usually what happens is in the fistula, abscess and all that, it forms in this area. Yeah, it can form in this area, and it can drain into towards this. It can be inverse. Yeah, it can flow on this side too. So so about the fistula, what happens is there are four types of fistulas, mainly in the anal region. Four types. Easy to remember them are with the mnemonic site. Yeah, SITE. Yeah. So here on this side, I have drawn this. This is the external sphincter muscle. Yeah, and this is the anal internal sphincter. Yeah. So this is your external sphincter, and this is your internal sphincter. I've drawn these on the both sides. So here it is your internal sphincter, this one, and here is your external sphincter, much more bigger, much more large, comparatively to your internal sphincter. So this side is, I haven't drawn the fistulas on this side, so I have drawn the fistulas on this side. All the four fistulas on this side. Yeah. So let's start. So the mnemonic was site. Yeah. So let's start with the S. Yeah. So first of all, site. S is for supra, I is for intersphincteric, T is for transsphincteric, and E for extrasphincteric. Yeah. So it's all about talking about these two sphincters which I've drawn here. This is your internal sphincter, and this one is your external sphincter. So fistula is easy to remember. It's all about just these two sphincters. So all the position of the fistulas getting formed relatively to these sphincters makes them this is how they are named. They are named. Yeah. So mnemonic was side. So let's start with the side. So this one is supra. Yeah, S, supra. So what you can see here is this is a fistula getting formed. This is the rectum area. This is the anal area. So here you can see supra. So supra means above. So this one, as you can see, is passing through your this thing, internal sphincter. Is passing through your internal sphincter, but here you can see it's going above your external sphincter. This one was your external sphincter, this one. So it's going above, it's passing through your internal sphincter, but since it is passing above your external sphincter, that's why it is known as supra this one. All right, this is your supra sphincter fistula. Then let's go with I. So I is inter. So since I is inter means between, so it should go between these two sphincters. Yeah, it should go between this sphincter and this one, external sphincter, between internal and external sphincter. Um, Interispheric sphincter, fistula, sorry, will pass through. So here is your sphincteric fistula. So see, this one was your internal sphincter, this one was your external sphincter. This fistula, intersphincteric fistula, ISF, yeah, you can say ISF. So this one is passing through between both of these sphincters. Yeah, see, this one is passing through between these two sphincters. All right, then site. Then it was T. So T is with trans. So trans means passing through. So here you can see T. T mnemonic, the T word in the mnemonic site, T. So since T, transsphincteric, it should pass through both of these sphincters. So see, here it is passing through both of the sphincters. So see, this one here. So it's passing through even the internal sphincter and even the external sphincter. So this one is, that's why it's known as transsphincteric fistula. Yeah, and last word, the last letter in the mnemonic site is E. So E is should be extra. Yeah, extra. So here you can see extra sphincter is passing neither through your internal sphincter, neither through your neither through your external sphincters. Is passing all above, all passing above all, both of them. Yeah, so do not confuse extra with supra. Yeah, supra was passing through internal, but above the this one external sphincter, but extra sphincter fistula is passing bit above. It doesn't passes neither through internal sphincter, neither through your external sphincter. Yeah, so that's why it's extra sphincter. So easy to remember. Site, yeah, SITE. So, and their position is very easy. All right, so let's talk about the Goodsall's rule. So here's the Goodsall's rule. Here you can see I've drawn two diagrams. Yeah, so here's your anus. So it's like a supine position of the patient. Yeah, so patient is supine. Yeah, so here's the patient's back, and here is his abdomen, and this one is, here's the patient's back, and this is a kind of a prone position. Yeah, so so this one is the patient's posterior part, his back, her back, and this one is the anterior part, all of the patient. So let's go rapidly, very fast through this Goodsall's rule. So Goodsall's rule, what does it says? Well, first of all, why Goodsall's rules is important. So as I talked about in these fistulas have internal and external openings. Yeah, so external opening would be somewhere in the skin, which you can see. Yeah, and there's a tract, there's kind of a tube. That's why it's a fistula. You can even palpate sometimes. Yeah, it can be palpated, but the internal opening of that fistula, it can't be seen, even it can't be palpated. Yeah, because it's somewhere inside. So external opening. So here in this diagram you can see, here's the external opening, here's the skin of the patient. Yeah, so here you can see have the fistula, and this fistula is somewhere going inside near the anal region. Yeah, here's a fistula, another fistula. Here's the opening, external opening. This one is the external opening. This one is the external opening. These are the external openings in the skin. Here's another one, mirror image of this one. Yeah, this one on the right side, this one on the left side. So the mirror image of this one. So here you can see external opening, internal opening. Same here, external opening, internal opening of this fistula, and here's also external opening and internal opening. Yeah, so external opening are at the level of skin. Yeah, much more superficial, and internal openings are always deep towards your anal region. Yeah, so here the thing is, suppose if I already talked about the patient is in the supine position, and this is his anterior surface, anterior part. So here you can see, if the external opening of the fistula is anterior to this imaginary line which I have drawn here, transverse imaginary line. Yeah, this one is the transverse imaginary line which I have drawn through the anus. Yeah, So if an external opening, yeah, of that fistula is above, is if it's anterior to that transverse, imaginary transverse line, ITL, yeah, then that internal opening of that external fistula would be straight. So you can imagine, suppose this was an external opening of this fistula. So if it is anterior, if it is anterior to this imaginary line, then internal opening would be straight. Yeah, so you can imagine, suppose this is you can see, suppose in the patient you can see this external opening. So then second thing is what you are supposed to do is whether this is anterior, whether this is posterior. If the external opening is anterior, then you can imagine, you can assume that the internal opening would be somewhere here, yeah, because it is straight, because it should be straight, yeah, because it's anterior. But what if the external opening you can see is posterior to this imaginary line, yeah, if it is posterior to this imaginary line, so in that case what you must assume, it won't be straight, it would be curved, yeah, it would be curved. So in brief, whenever external opening is anterior to imaginary line, yeah, the internal opening would be somewhere here, and that because it would be straight. But if external opening is posterior to this imaginary line, yeah, then internal opening won't be here, instead it would take a curved path, it would take a curved path, so here, yeah. Same thing over here. Suppose this is the back of the patient, this is the anterior of the patient, prone position, suppose. So let's see, if this is anterior of the patient now, yeah, so external opening, if suppose is anterior to this imaginary line, this one, yeah, then internal opening somewhere near the anus would go take a straight path, yeah. But if external opening in the skin somewhere, yeah, is posterior to this imaginary line, yeah, then it won't be a straight, it would take a curved track, this fistula would form like a curve, and internal opening would of course would be here, but the fistula would be a curved fistula, yeah. Here it was in straight fistula. Same thing on mirror image on this side. Suppose here's the external opening. Now what you, as a surgeon, what you're supposed to do is, if you see in a patient, yeah, if you see in a patient external opening on this side posterior to the imaginary line, what you will do is, next step is, you of course you will notice that the fistula, the external opening of this fistula is on the back of the back on the posterior to this imaginary line. So in that case you can assume that internal is this fistula would be a curved fistula, yeah, this fistula would be a curved fistula. And if you think if you see, and if you see and this thing of external opening in the skin, but it's assuming that this is anterior, if you can see this is anterior to the imaginary line drawn through the anus, then in that case you can assume that the fistula would be straight, fistula would be straight. These are important because for the treatment purposes, yeah. All right, so this was the thing. Only an exception for the Goodsall's rule is, Goodsall rules exception is, suppose if there's a external opening which is more than 3 centimeter away from the anal canal, yeah, from the anal region, 3 centimeter, more than 3 centimeter. So in that case, first of all, it should be if it is far more than 3 centimeter, and if it's in the anal region, if you can see that in the anal region, then that fistula would take a curve, that would take a curve. Because why this is an exception, because as I already mentioned, if fistula, if external opening is in the anterior region, anterior to the sphincter line, then those are normally straight, yeah, those are straight. But in this case, if, even though the sphincter external opening is in the anterior of the sphincter line, it takes a curve. Why this is an exception? Because this is more than 3 centimeter away from this region, anal region, more than 3 centimeter. Even though if it is, even though it is in the anterior region, yeah, internal it will take a curve. It would take a curve because it is more than 3 centimeter, yeah. So here's a Goodsall's rule. So the thing is, if this external, here you can read also, if the external opening is less than 3 centimeter, yeah, here it is less than 3 centimeter, then if it is anterior, these two are less than 3 centimeter. So if the external opening is less than 3 centimeter from this anal region, then if it is anterior, then it would be straight. And if it's less than 3 centimeter but it is posterior, this external opening, it would be a curve. Yeah, same thing. uh, but exception would be if this external opening, you can notice, if it is more than 3 centimeter and it is present in the anterior region, then it would be a curve. It would be a curve instead of straight. All right, that's all. Thank you.